Hi, everyone. Welcome to episode 30 of the How to Become a Doctor video podcast. This is put on by LSU Department of Phase, which is pre-health advising, support, and education. So my name is Matt Durst. I'm one of the pre-health advisors, and I'll have our director introduce himself.
Yeah, I'm Robbie Bowen. I'm the director of pre-health programs here in the College of Science at LSU. So thanks for joining us. If you're enjoying our videos, make sure you like and subscribe to our channel so you can get updated when we do new broadcasts.
Yeah, so in episode 30, so you definitely check out the other ones. We're always building off of them, but they are standalone episodes. And we like to record, right now it's March. It's a what's in the air for pre-health advising and pre-meds is application cycle, but also re-applicants. And there's a lot of you guys out there, maybe you're on a wait list, maybe you got rejected by schools. Either way, you're making plans to reapply. And we wanted to, just take some moment to pause and I'll give some tips for re-applicants since it is a little bit different. You got to think through it. Even though there's some similar things, we wanted to reflect on that. And so, just wanted to mention, if you're a re-applicant, you're not an anomaly. You're actually very common. Only about 40% of those that apply each year to get into medical school. I've heard different stats, like 1/4 of those who get in were re-applicants, things like that. But we want to talk about, you need to go and reflect back upon what was it? And we're going to talk through some of these things, but what was it you think that didn't get you in? And then that the second thing, of getting feedback. Maybe the school will do a meeting to give you feedback. Maybe you can get feedback from your pre-health advisor like us or wherever you are, maybe from family and friends or a doctor who's a mentor. And then, definitely make a plan. And so we do want to talk through some of these things, but Robbie, I did want you, we were looking at some AAMC resources. I know you mentioned those three things: metric, attributes, experiences. Why don't you talk through each of those, the big kind of categories to think through?
Yeah, so these are sort of uh, generalized terminology, but basically they're judging or they're assessing applications, and there are things that go into that, like fit at the institution. Do they feel like you fit here? Are you going to be able to assimilate to the culture and the experience of their schools? But as an individual, there's kind of three areas that they're looking at. One is the metrics. So that's the numbers. That's your grade point average. That's your test score. That your performance in predictive courses that indicate whether you'll be successful or in medical or dental school. So those are pretty obvious. If you are not at the MCAT score that is their in their range of typical acceptances, then you know what you need to work on. You need to focus on improving that test score. The next thing is experiences. That is exposure to the field, experience in what you are planning to do, whether that's medical school, dental school, whatever. You need experience, exposure to that field. So, when you're assessing your application and looking at situations, how do you stack up in that area? And if you don't have hands-on practical experience, it can be jobs, shadowing, volunteering, but that's something that you can focus on to improve your application for next time. And then the last one is a little bit more subjective. It's kind of the attributes. That's sort of your personality, your personal skills. Do they see you as a kind, caring, compassionate person? Do they see you as that you're ready for this challenge? Some people need a little bit more time and a little bit more life experience. But these are areas where, it could have been that, you just didn't describe your experiences well enough. They didn't get the sense of, of that commitment or compassion. So attributes are a little bit more subjective, but you always want to be able to, maybe I need to do a better job of my personal statement, of showing my commitment and my drive and ambition of why I want to be a doctor. So those are kind of the three generalized areas. Not everything, is fits in either category, but those are the three overriding aspects that they're looking at.
Yeah, and it's good for usually one of those can probably grow in everything, but one of those is it should jump off the page at you most likely, and definitely something you want to lean in on. We talk a lot about, you know, you don't need to be perfect in any area, but you need to be good in every area. because as a doctor, you're going to have to be a test taker. You're going to have to be a student. You're going to have to be a clinician. And so they want to make sure, okay, you don't need to be a perfect test taker, but okay, you're going to have to pass the step one and step two. You need to, not flunk out of med school. And so they're thinking through these things. But, we want to kind of go pragmatically into this a little bit and zoom in, so maybe, for example, we start with that metrics category, and we're thinking about the MCAT, maybe the DAT, maybe the OAT, one of these standardized tests that you're a little insecure about your test score, just wondering, do I need to retake? But, so Robbie, why don't you, just talk through, how do you really know if you need to retest and retake the test?
Well, I think that you want to definitely, this is where you need to do a little research into the schools that you're applying, and you can, go to the MSAR, the medical school admission requirements. There's also a dental school admission guidebook, and just look at who are they accepting? What are the range of MCAT scores or DAT scores that you see them? They'll give you their median score, their mean score. They'll give you the range of test scores, and so you want to be in that range of where they've accepted students. Now, there are always, again, you know, nothing again is, like the bottom line, but you want to be at least kind of in their sweet spot, so to speak, of the people that they're accepting every year. And so, there are all these things that say 60th percentile or higher on the MCAT. They can show you statistics that show that people need that that demonstrates that you can at least be successful. But then when you start looking at, well, who's getting in, it's higher than that. It's 75th percentile or higher. Now, again, the MCAT is one aspect of the whole picture. You just don't want to give them any concern or cause to question, will this person be able to be successful if we accept them? And so, that's where you need to do some homework while you're waiting for the next cycle to open. How did I stack up to the people that they've been accepting? Where are the areas that I'm a little bit below? Do I need to go back and take some more courses to get my grade point average higher? How do I, if I do need to retest for the MCAT, what am I going to do? What game plan am I going to put together to retest?
And here's the struggle with this conversation we're having, that Robbie bringing up here, is the fact that some of the stuff like this, if it's March and you realize you need to reapply, some of the stuff you have time to do, right? If you need to retest for the MCAT, well, you could start studying and retest, by the summer. But if you need to retake some classes, well, you might, push back another cycle. So it's not to discourage you. Med school will be there. The average age now to start med school about 25. But just remember, you're always a year behind. Your application's always a year behind you. So if you apply this summer, well, then a year is going to be happening. So you got to think about, well, you always need to be working on yourself. Is there some way that you could be improving yourself during the interview cycle, just in case you had to reapply? But there are those things that you can do, during, last second. And so how do we, so let's say it's March, Robbie, and, you're thinking you need to retest. How do you decide when to do that retest for that cycle?
Yeah, well, I think, we're gonna, I think, touch on this a little bit, but a lot of times, sometimes people who are not accepted, it may not be any of those issues. You may have been strong in all the areas, but it came down to more timing. When did you submit your application, and you just kind of got lost in the shuffle at the end because they had already, had interviews and offered spots. So, you want to think in terms of timing, where, you want to be able to submit another application in the next application cycle at the earliest possible time. But we always say, you don't want to rush it, but you want to do it in a timely manner. And it's not going to do you any good to schedule a test tomorrow if you haven't done any additional studying, or you haven't, at least tried to assess your performance to see what areas of the test did I not do so well in, and go do some more targeted studying in that area. So the test dates are for the rest of this year are out. You can go, and, target your date. I would look for some date, early in the summer if you can do it that way. But again, you don't want to take it again and get the same score. You need to be able to have time to do some, well thought out, planned studying between now and then. So, do it when you're ready and prepared to get a better score, but you should be working on that now, not waiting, until the end.
Right, yeah, because I mean, there's no risk. Look, if you're on a wait list, it's no risk of starting to study now, just in case, because you might learn some stuff that'll help you in med school if you end up getting in. But if not, you're ready. And that's the tension, right? That he's talking about is, you test too early, it's a low score. You test too late, late score. So it's okay. When is that kind of perfect timing? And thinking through that, a general rule is anything through May would never delay an application. That's going to release in June when applications are sent to schools. June, we're still sitting pretty safe. And as we start to get into the July, you see that, right? They roll out those test dates first, and then the July through September are usually the ones that they're a little bit later, a little more risk, but but definitely talk to your free health advisor, and think through it clearly, and at some point you just gotta make a decision on the retest. We have another episode on post backs. You may need to do some more classes, things like that. Tough thing to do as a reapplicant if you weren't planning on it, but it can set you back another cycle. But something to think through. But I want to go to another attribute we haven't talked about. This part of the applicant, but the letters though. So let's kind of, Robbie, why don't you just share a little bit about how to let's say you used the review committee last year, you had some letters sent in, now you're having a regroup. How do you think about getting your letters ready for another cycle?
Yeah, well, I think that, you know, if you're getting letters from your review committee or whatever, you obviously want to go and review what their policies are. Here at LSU, it's a one-time thing in terms of using our review committee here. But if you feel like you're strong in those metrics and you have the experience and your attributes are there, then one area that you want to do is to do an assessment in the letters. And maybe my letters weren't as useful or helpful to the admissions committee as I want them to be. And that could be many factors like, I didn't give the letter writer, supporting documentation or, my resumes, I didn't keep them informed about what's going on. And so they just wrote a sort of a generic letter. So, you want to think about that, think about, do I want to get the same people to write the letter for me? But if I do, I'm probably going to maybe touch base with them and see if I can give them some more information, some more data on that. You know, the admissions offices, the letters are sort of you know tricky territory. The obligation there is that these people are putting their honest assessment, and the admissions office are going to, they don't want to violate the confidentiality between the letter writers, so they're not going to tell you the problem was your letters or anything like that, or your letters need to be improved. But if you've gone over everything and you can't really find any areas that you feel like this was maybe an area where I'm not up to par, then you do need to look at the letters. So, am I going to ask the same people? Am I going to get new people? But regardless, did you sit down and have a conversation with that person? Did you, talk to them about why you want to go into this profession and why it's important to you and what you've done to prepare yourself? Or did you just hand them, here's a vita of my experiences? They read hundreds and hundreds of letters just like they read application packets. And so they're looking for, individual stories. They're looking for a more in-depth explanation. Everybody's a good student. Everybody has success in different areas, but it's the more personalized letters that stand out. So, you know, did I take the time up front to really establish, you know, a relationship with the person who's writing the letter, or did I just conveniently ask somebody that to meet a deadline or whatever? So, you know, get in touch with them, go have a meeting with them, sit down with them during office hours, share your passion for what it is that you want to do. Ask them what would be helpful that I could provide you to write a letter for me. So be proactive, I guess is the what the point we're trying to make here. And making sure that they have supporting documentation that can help them write a more useful letter.
Yeah, and I just want to remind you guys too, letters are the requirements and they have specific requirements. This isn't some sort of icing on the cake sort of situation. You have to view this as seriously as, hey, I have to have, two organic chemistries for this medical school. I have to have this amount of letters that are this sort of way. And even our school split a little bit in how they've communicated to us. Is just, LSU, we have two medical schools. We only write you one committee letter ever if you're using our committee letter. But the next cycle, we will send just that letter unchanged to the schools. Well, LSU Shreveport at this point has communicated to us, look, because it's an old letter, they want three professor letters, but they don't have to be science or anything like that. New Orleans has told us, okay, well, you have the old letter one more year. We'll use that as your catch-all letter. Sure, you still want the other faculty ones as bonus, but and so just definitely clarify. Say, hey, I'm a reapplicant. Maybe I'm using a committee letter from the last year. That's the only old letter you can have. And like Mr. Bone had said, the other letters, yeah, reassess, but yeah, definitely they've got to be fresh letters. You can't use the letters, even if they just update the date and a couple little things. But you have changed in a year. Let them know how you've changed. But I think this is very much a slept-on thing in med school admissions, that it is such a requirement. University of Arkansas's medical school, they require the review committee letter if you have one. So these are serious things. It's not just a little bonus to your application. And I just want to emphasize, I had a student who didn't use the committee letter. They only had two letters to LSU New Orleans, even though they require three letters in the committee letter, and they didn't get in. And everything looked amazing, but they didn't meet the requirements for that medical school. Period. And so we have to really focus on that. And you don't want to make that same mistake twice. And so obviously, like the numbers matter, the letters matter, the timing, but I do want to pause and just talk about Robbie, something like a personal statement, or the most meaningful experience essays. How do you tackle a personal statement where you don't necessarily throw the whole thing out and rewrite it, but you don't use the same one? How do you approach a rewrite?
Well, I think that, you don't want the mistake. You don't want to send the exact same application that you sent this year. It didn't work for you this year, and you turn around and send the very same thing next year. That doesn't look like you invested any time or effort into, trying to improve or upgrade or whatever. So, your motivation for medicine or dentistry haven't changed over the last year. So the basic concept of what you're writing about in the personal statement doesn't necessarily need to change, because that hasn't. You that whatever that was that motivated you then is still motivating you now, most likely. But maybe I'm going to go back in and tweak, and I'm going to add a paragraph about not getting in, and sort of, this was a wake-up call for me, or this was something that I had to really think about. Do I really want this? And I come to the conclusion that I do, and then I've been focused on ways that I could be more competitive or whatever. Just kind of acknowledging that you understand that for whatever reason, you didn't get in, but you didn't give up. You didn't just say, okay, well, that didn't work out. What else am I going to do? You're showing that I am serious and determined to achieve this, and I'm back, and I'm ready to do this again, and I'm going to, do everything I need to do to be, to be successful this time. So, don't just repackage what you sent before. There are areas that you can, experiences, you have more hours of experiences that you need to go back in and, did I do a good job of showing enthusiasm? Did I, give examples of where I've learned and grown, and, what skills I can take away from the experiences that I listed last year? So you just don't want to repackage something that is a year old now. So, and I think that that can be convincing to show that I could have just tucked my tail and gave up and went and found something else to do, but I know this is what I want to do, and so this has been motivating for me, not defeating.
Yeah, I remember they can go back and reflect upon, or look up what you had submitted last year, and the deans have told us that they've found the same typos in the same applications from some copy and paste. I mean, that is a no. Of course, we want you guys to get in, and so if you're not taking the time to submit your one application and come through it was they go through 6,000 of them, you're making them read the same thing twice. So just definitely you want to refresh. You do not need to throw the whole thing out. I mean, unless you can, but you definitely, want to read back through it, double check, make sure, hey, do I want to stand on this application for a whole nother year again, or do I want to go back and refresh it? So, but I want to hit another topic. We talked about how to, make yourself better. There's also the backside of this thing is who's reading it. And so sometimes, students change their school list. So, Robbie, how do we think through advising students about maybe changing up their school list? What could that look like?
Yeah, I think that again, that's why the research part of this is important, to go and look at the MSAR or other resources that are available out there to get an idea of what it is that a medical school is looking for in an application. So maybe, you go and reread, the things that they talk about on their admissions website, and you kind of pick up, they talk a lot in here about community service and community involvement. So I'm going to tweak my essays and my narratives that I talked about to focus more on my community service and involvement. Maybe I didn't really spend a lot of time talking about that, and I realized that from the reading their information, they talk about that a lot on their admission site. So it's trying to find where can I find commonality in my application with what they're showing from their admitted classes and the people who've come in over the past years. And so, um, you know, I, I think that's somewhere where a lot of maybe applicants don't do the diligence, like they don't really go and try to get a feel for the vibe and the atmosphere of the particular school. They just go down a list, and I know people who go here, or this is people that close to me or whatever, and I'm just going to pick this random list of schools. But you really want to spend time in seeing, like, where do my values fit with other schools. If they are totally focused on a region, like they talk specifically about Appalachia or whatever, and I have no contacts or ties to Appalachia, is it really worth my time and effort to really, spend time and money applying there? So I want to try to match, I want to try to show as much over, commonality as I can into what they are focusing and stressing as, their values and the school culture that I'm applying to.
I mean, we think through as well, like what applications did you submit? Maybe you just submitted an AMCAS application, but, the second time you say, you know what, I want to be a pediatrician, and I know that, MDDO both match really well in that field. And, I'm already 1 year further on my journey than I thought I'd be. And I can still submit an AMCAS, but I might submit an ACOMAS this year and apply to some DO schools. And sure, if I get into, an MD one, I'll go there, go to DO. Maybe maybe you apply to DO and, you're really not even in that caliber, and you may consider an international school, Caribbean school, to know, hey, look, this is I'm ready to get to medical school, and I just want to give it a shot down there as well. So think of things through like that. But also just as Mr. Bowen's saying, combing through the data. If you're like, well, I applied to Florida State, but then I went and looked up them on MSAR and realized that, okay, they're not very out of state friendly and they almost take all in staters. But I saw this other school that, takes a lot of out of staters, so thinking about that, think about how your year has changed, that maybe you went and visited a certain spot and have a tie there now. But really, you might think, hey, look, I want to go to sports medicine, might be interested in podiatry, or another parallel field, something like that, as well, that can get you there. So definitely explore those. We've had a lot of success with students, and you're a little humbler after you're a reapplicant. And so you might be thinking through some more realistic things. That's the cool part about all this, is you can apply to multiple schools and submit multiple applications to give it a shot. So, there's definitely all those things. We have these sort of core uh, things about applying, but I think I also wanted to kind of just talk about the soft skill type stuff, networking, and also interviewing, the actual interview piece. So, Robbie, why don't you share just about some of those kind of intangible things and the difference it can make for a reapplicant?
Yeah, and I think that, that's that kind of attributes category that we talked about. They're not just looking for smart, intelligent people who are good test takers, who, you can have all the science knowledge that you know, you can answer any question there is about scientific information, but it's more than that. This is a career that is so people focused and oriented. And so communication skills, um, the compassionate nature, the servant kind of heart and attitude that they're looking for. So, you want to think about that, in the interview. Were there times where I maybe could have been a little bit more thoughtful or a little bit more compassionate in the response or the answer that I gave? Did I come off maybe as I don't know, arrogant or entitled or something like that? I mean, you want to spend time like reflecting, thinking about the interviews, thinking about the things that happened during the time of the application, personal reflection, personal thoughts. Where did I maybe miss an opportunity to do that? And but the interviews sometimes, it's hard to judge them. You're nervous, and interviews are interviews. They're sort of awkward by nature. But, did I have an opportunity with a question that I was asked? Did I miss an opportunity where I could have, talked about a service project that I did that would have shown, you know, my kind, caring, considerate nature? And I just kind of, um, just gave a sort of a rote answer or a rote response. You know, this is a field where, emotions and feelings and things like that, um, you have to have, you have to thread a needle. Like they need to be able to know that you can handle, stressful situations, but they need to see that you can do that while being kind and caring and compassionate to people. So, being too timid, too lacking confidence is, just as bad as being overconfident and being, overbearing or entitled. So, you know, thinking about that, where are some ways that I can, be a little bit more balanced or be, improve whatever happened that that comes to mind while you're doing that.
That's good. I mean, these are all just things to think through. Maybe, you can't see them yourself. So, someone who you think knows you well. And we always say, talk to someone who knows you really well about why do you think I maybe didn't get in? And then talk to someone who doesn't know you well. So they can, and show them your different stuff and your attributes. And sometimes you can get some helpful different angles to help you see clearly so you can grow and, have your ears open and your mouth closed to listen and receive that feedback. One other thing I wanted to mention is as a reapplicant, remember that requirements can change cycle to cycle, and uh, the biggest way it's changing right now is honestly these situational judgment tests. Is the Casper required? Is the preview exam required? If you don't even know what we're talking about, check out our other episode on preview and Casper. But this list is changing like crazy. So definitely you might not have to take I didn't have to take the preview for that school last year. Well, you might have to this year. And so just be aware that you are a reapplicant. You don't get to bring any physical things from last year. Your MCAT does last for 3 years. We should mention that. So you can bring the same MCAT score if you like it. But the other things, you get to resubmit. You're a new applicant, and so there's many good things about that. But also you got to be aware and to know that you're coming in with the new requirements, the new year, the new processes, and just be aware of that.
Yeah, and every cycle is a new creature, a new animal. Like everybody starts at the very beginning and starts all over in the process. And you might have been one of the last people, on a waiting list that didn't get in, but that doesn't mean, you're at an advantage next year. You still have to s- submit your information. You still have to present yourself again. And there is the AAMC.org has a section on reapplications where they talk to admissions deans about, advice. So definitely take an opportunity to go look at that. And what you're going to see in there is like the admissions deans talk a lot about personal reflection, spending time in thoughtful consideration, looking at your application from, a different perspective, and sort of doing that. There's some really great inspiring stories of people who have taken multiple times applying to get in that, maybe you can learn from. But it's you need to spend some time in thinking about why do I think I didn't get in, and what can I do differently this time to do it? And just keep in mind that not getting in, the admissions people aren't saying never. They're just saying right now, We don't necessarily feel that this is the time for you. Maybe you need more life experience, maybe, that kind of thing. So it isn't a like always no, it's right now. This isn't, we don't see this as a fit for you, but next year, bring back, come back and let's see where you're doing. But they should be able to see moving forward and improvement, even if it's just in the confidence in the way that interview or whatever. Um, you just always want to give the impression I'm moving forward, I'm trying to improve, I'm doing what I can do to keep this goal of mine in place.
Yeah, and I think I want to mention, Robbie said not this year, but also it could be the perspective where they said, honestly, we wanted you this year, but we just didn't have the space. It's a competition. So do not take it personally to think that they don't think you'd be a good doctor. That's not what it is. They have so many people who they think they'd be a good doctor. They just don't have enough spaces to train them. And so if you're on a wait list, that means that they think that you would be successful if there is room, and you should take that as a compliment to say, okay, well, wow, a lot of the post-bac programs we talk to, they say, if you were waitlisted for medical school last year, they're very excited about taking you to their post-bac program if that's the best for you, because they said, wow, well, this school thought, hey, if there's space, you would succeed. And so take that as a compliment. Obviously, you didn't win the competition and went out, but I mean, like Robbie said, if they have 200 spots there, you could have been number 201. We don't know, and so maybe next year it will be your year.
But that goes back to again, and we're always stressing as pre-med advisors timing, and it's so important to submit, in a timely manner, to turn everything in as early as possible. From their mindset, if you waited until October to submit your AMCAS application, I wonder, like, do you really want to do this? Like, is this something that's really important to you? Because I already had 3,000 applications by the time you even submitted yours. And so, there's 3,000 people, at the bit, biting the bit, to get in, and you just kind of came in at the end. I have to wonder how motivated you are. And there could have been, some reasons behind that while you waited, but, that sometimes that's all it is. It wasn't that there was a weakness or there was something that prevented you. It's just, I had already interviewed, an entire class of people, and, I just don't have room for you.
So anyway, there's much more to say. We're glad to meet with you for that, but thank you for checking us out, and we wish you the best.